So currently we're pretty much running a full service. It's slightly altered in terms of phone consultations rather than face-to-face contact, but we are still investigating and treating breast cancer. The only major change that's notable is that we're no longer, or we've suspended screening for a number of months because it's really not deemed essential. There are particular high-risk groups, for example those with BRCA1 and 2 genetic mutations, who are particularly at high risk of getting breast cancer, and they're typically under a breast specialist, and for many of those we may still offer screening imaging safe with an MRI scan. So telehealth has really taken off in caring for follow-up patients and for non-urgent referrals. We're still having face-to-face consults with those patients who are likely to have a cancer and need surgery because they need more comprehensive examination. But we're certainly using telehealth readily throughout the surgical community. So thankfully there aren't very many benign breast emergencies, but they are typically patients with abscesses, be it with lactation or non-lactational abscesses. And those patients need urgent referral for image-guided drainage of those abscesses, or on some occasion they might need surgery. So yeah, if you've got any urgent referrals, you should ring up your preferred surgeon, and those patients will be seen promptly. So it's pretty much as it would have been before the pandemic, in that those patients need thorough assessment with appropriate imaging. Usually that's a digital mammography, tomosynthesis and ultrasound, and then an urgent referral to your preferred surgeon, and we will see those patients promptly. Absolutely. Most breast imaging centres are open. And if they're not open, they'll direct you to an appropriate centre. So any lady with a suspicious lump, particularly older women, because most breast cancers are diagnosed in older women, but that's not to say a younger woman can still have a suspicious lump, especially if it's associated with skin changes such as dimpling, distortion or peau d'orange. And in the context of also having lymphadenopathy, then clinically these patients are almost certainly going to have a breast cancer unless proven otherwise. I think it'd be appropriate in those circumstances to get diagnostic imaging with digital mammography, tomosynthesis and ultrasound. It would then be appropriate to refer to the treating surgeon to organise the biopsies as needed. So certainly if you've got a younger patient where the probability of getting breast cancer is considerably less, and they've got a benign feeling lump which is typically mobile, smooth, like a breast mass, or it's fluctuant consistent with a cyst, then these are certainly lower risk scenarios, and they can be easily imaged with a targeted ultrasound, and many of these patients can be reassured without the need for a biopsy. So certainly you can phone any of us surgeons and we can advise you. Imaging with targeted ultrasound can be very reassuring. Many lumps that we see in fact turn out to be mounds of normal benign breast parenchyma, and certainly that can be very reassuring for a patient with a low risk non-interventional test. So generally speaking, everything is much the same. We still continue to have our multidisciplinary team meetings, but we're just performing those via the telehealth system. In terms of reconstructive surgery, there has been a shift there to avoid an immediate reconstruction. We're actually deferring that to a delayed reconstruction down the track.
On the whole, unless the patients are extremely old, there'll be no change. Patients will be discussed at multidisciplinary meetings. They'll be offered drug treatment, which could either be endocrine therapy, could be antibody therapy such as Herceptin, or it could be chemotherapy. They'll receive radiation therapy as normal because our aim is to cure as many people as possible. I think there are two things. The first one is to reassure people. At this point in time, the infection rate is low and testing has started and is coming. The second thing is if patients have any symptoms at all, upper respiratory, lower respiratory symptoms, or the cluster that is the characteristic COVID symptoms, they need to be tested. Now, there are a number of different testing sites around Melbourne. They can be tested at the Cabrini General Practice Centre if you don't do it. They can be tested by yourself. Melbourne Pathology offer the test, or they can be tested at Cabrini Hospital. There will be some changes in that older patients that were potentially borderline for chemotherapy, that have hormone receptor positive disease, will almost certainly just get endocrine therapy. Otherwise, there will be very little change. Current recommendations for patients to be dealt with by telehealth. So from my practice and from my colleagues' practice at this point in time, everyone in routine follow-up will have their normal investigations done, and we will contact them either by phone, Skype, Zoom, or whatever communication method they wish to discuss their results and then make a further appointment to see them. Once again, these patients are discussed at multidisciplinary meetings and a treatment plan will be organised. The reality is, for people that have relapse, it will depend on their curability in terms of the intensity of treatment that they receive. On the whole, we have a number of different treatment options, particularly oral treatment options now, that will allow them not to be exposed to the hospital as much as they potentially would if they were having chemotherapy. So there are a lot of options for treatment of people with metastatic breast cancer, and people will have tailored treatment depending on their individual circumstances. So the reality is you need to call, and you need to call one of the specialists that are dealing with your patients, or a specialist that you have a relationship with if they don't know the patient. By all means, call us. This is a very difficult time for all of us, but we are here to help you, and our individual colleges, our individual professional associations have all given us specific advice on how to treat patients with cancer. So we can give you up-to-date information regarding any problem you might have with a patient with cancer.